Cabrera, and I'm proudly in my perimenopause era. Buti na lang uso yung term na era because it makes everything sound so much cooler. And that's what we're trying to do also this morning, to try to acknowledge, learn more about perimenopause and menopause. When I was younger, only knew the term menopause. Hindi ko alam na meron palang term na perimenopause and that it spans 10 years or something like that. And we're gonna know a lot of information about it together, whether they are research-based or experiential. But the great thing about that is that we're all here to find out more about this, how we can support the ladies as we go into this special journey of our lives. As you can see here at the front, we have some beautiful perimenopausal or menopausal ladies, and proudly so. We've got Claudine, we've got Michelle, we've got Dr. Herrera. We'll hear from them later on at length. They've got some presentations for you guys today, very heartwarming, very informative, etc., etc. So welcome to the Pro-Age community first and foremost. You'll also learn a bit more about that later on. It's a great community that you can find on Facebook. And through that and through the acknowledgement of perimenopause and menopause and the very specific and special needs that women have, Pro-Age beauty products or products have arisen from that. So you'll find out a bit more about this thing called menogummies. I think you guys have your kits with you. Menogummies, and then there's also the Sita skincare line. And I just want to say that I'm a proud user. May iba pa bang word sa user? Parang laging negative yun term. I'm a proud user of the Pro-Age skincare line, and I can swear by them, and I'm so glad that a lot of you have your own kits so that you get to try and see why I'm so excited and so proud to be partnered and be one of the ambassadors for Pro-Age. So, oh my gosh, thank you for making it here today. And as we know, that's why we do these press events, is to get the word out there so that people can understand a little bit more about perimenopause and menopause, lalo na for our partners in life. Good luck to them, di ba? Must be difficult also to try to be empathetic about something that you don't experience yourself. But it's not just us, we don't make things up pala. A lot of us feel the same things. Aches and pains, dizziness out of the blue, a little disoriented, forgetfulness, foggy brain, and my favorite of all, weight gain. Diba? Ang favorite natin lahat. Why? What do we do? What can we do? Is there something to be done? Or do we just embrace the process and age gracefully? I think that's a great solution as well. So ladies and gentlemen, we have an extra special speaker to start the show with for everybody today. To begin this meaningful conversation, we're privileged to have with us an expert who has dedicated her career of more than 35 years to women's health and wellness. She is well renowned in the field of obstetrics and gynecology, and her private practice is in premier institutions like the Makati Medical Center, also the Medical City, and St. Luke's Medical Center. She is with us today to provide valuable insights into the physiological and emotional changes women experience during the menopause. Her expertise is vital in breaking down myths. Uy, marami tayong mga kasabihan. Totoo ba yan, Doc? Perimenopause ba yan, Doc? Addressing common concerns and shedding light on how we can all navigate the stage with confidence and knowledge. Without further ado, please join me in giving a warm welcome to Dr. Annabelle D. Herrera as she talks about the journey called menopause.
That's a whole lot of introduction about me. Thank you. I'm here because of Claudine. Just to give you a brief background, I delivered her first son ages ago, and we met providentially in one talk show. And this all started, and I found out that she is an advocate of menopause, while I am an advocate of women's wellness. So today I am here, and I would like to thank you organizers, Susie, Michelle, your husband Jay, for inviting me and for this opportunity to share with you women who are going through this and who will go through this challenging journey called menopause. Globally, it is important to understand that the woman's life expectancy is nearly 80 years. So whatever age you're in, 40, 50, you have a whole lot of 20, 30 years ahead of you. And so, let's all stop and pause. Where are you in your life cycle? And what is your quality of life? Here you will see the circle of life that each woman today, present, will go through or will go through each phase and each stage. Infancy, childhood, puberty, childbearing, perimenopause, menopause, and the geriatric. It is important to understand that each one of us has an individual clock, biological clock, that is programmed before birth and will tick off at its own time at each phase. Okay? So, as we go through infancy, childhood, puberty, let's pause. Do you remember when you had your first menstruation? You remember the age? Okay, wonderful. It is important, again, to point out that puberty is actually the best part of our circle of life because it sets the time for the longest phase that we will go through. That is 30, 40 years ahead of us during your childbearing and reproductive years. Okay? Now, I have to briefly give you some biology 101 lessons just to help guide the journey. So here you will see the female reproductive system that is divided into the external structures, that is actually the face down under. Okay? And you have, today we will talk about, more importantly, the internal structures that consist of the uterus, fallopian tube, and the ovaries. Alright, you must understand that the uterus is what we call the bahay bata. It just carries a pregnancy and it is responsible for the menstrual debris that is actually secreted from our body outside our body. It does not carry any hormonal function. Alright? The fallopian tubes are actually the site of fertilization where the egg that is released from the ovary in an ovulation, in a process called ovulation, is built into the fallopian tube. Alright? Now, the ovaries, which is actually our point of interest this morning, is the main source of two female hormones called estrogen and progesterone. Estrogen is responsible to many functions and changes in our body. Now, here you will see the ovary. Let me emphasize the two functions of estrogen. One, it prepares the uterus for always a possible pregnancy. Pinapakapal niya yung lining ng uterus. Alright? Second, the estrogen hormone will also now increase the levels of your follicles that contain the eggs that will mature at a certain time and then released into the fallopian tube in the process called ovulation. And when ovulation sets place, another hormone called progesterone is released from the ovaries. If, however, this egg is not fertilized by the sperm that will be swimming from the vagina into the cervix, into the uterus, this egg, alright, what happens? It will move down into the uterus and now, together with the thickened lining, will actually be excreted as menstrual debris. And this is through the help of progesterone. Okay, is that clear? This is a normal menstrual cycle. So, you can actually teach your children, your daughters, your grandchildren, whoever. Okay, now, let's go back. So remember what I said. Puberty sets the time for your childbearing years of almost 20, 30, 40 years ahead of you. And so when we move into the circle of life, where are we at? We are at the middle of our life. And so, women, correct, will go through a natural stage of their life called midlife. It is dominated by forgetfulness, fatigue, and even anxiety. Perfect? Okay, now, it is actually a transition phase. It is not, you're not going to stay there forever. But it is called the climacterium phase that encompasses the 3 stages of menopause, perimenopause, menopause, and postmenopause. And this will only last for 15 to 20 years. Only, I said, only, di ba? Sandali lang. Hindi katulad ng childbearing 30, 40 years. Okay. Let's go with terminologies. Ang dami kasi nako-confuse eh. When we talk about menopause, strictly speaking, it means the end of menstruation. Alright, it is a moment in time. It is not a phase. It is not a transitional phase. It is a culmination or the end of a biologic process that is where your body is undergoing this culmination. And to confirm menopause, there should be an absence of menses of about 6 months to 12 months. That is menopause. Okay? Now, what all of us always think of menopause is actually perimenopause. This is actually 5 to 10 years before your final menstrual period. And it can start as early, take note ladies, as early as 40 and may end at the time of cessation of your menses at 55. And perimenopause babies will only last for 4 to 8 years. Okay? While post-menopause, it overlaps, hindi naman tayo ganyan, no? Correct? We're not gonna look like a witch. I look like a witch. I'm post-menopause. So, postmenopausal women overlaps with the end of perimenopause and extends into the years after your last menstrual period. Okay, is that clear? Okay, let me just put this in a summary form. Perimenopause, you may still be menstruating, okay? But you experience menopausal symptoms, okay? Menopause, wala nang period. There's already a continued absence of menstruation. And for postmenopause, walang-wala na. But what happens? You are already now at risk of having heart and bone problems. Alright? Okay. I'm showing this to you because as we go through our circle of life, we are geared towards childbearing, correct? Reproductive. But when you go through your climacterium transition, the reverse happens. Your biological clock now is winding down and your reproductive system is also faulty. Alright? Okay. This is a very interesting slide that each one of you should put in your minds. Take note. This is very graphic. You have your circle of life: infancy, puberty, childbearing, menopause, and menopause. What are these? These are your eggs. that are in your ovaries. Okay, take note. At birth, we were only born with a certain number of eggs. Did you know that? Yes, unlike the men. Their sperms are continually being produced. So when you were born with only the same number of eggs during your whole lifetime. Hindi na yan magpo-produce. Okay? When every time I give this lecture, ay ganun ba? Kaya pala. You see,
Are they all just there?
yes, they're just all there. Okay, take note. You remember the menstrual cycle, ha? Remember the menstrual cycle. There's always an egg that is being produced every month. Okay, so, look at puberty. Puberty, kumukonti. What about the childbearing? Remember your childbearing is how many years? 30, 40 years from puberty. And look what's happening. There are only few eggs that are maturing and are released into the fallopian tubes by the process of ovulation. But, take note ladies, this is a fact. When you reach late 30s and you're approaching 40s, di ba perimenopause na yan? What happens? You have less eggs. There's already a decline in the number of eggs. And when there's a decline in the number of eggs, take note, what happens? You have less estrogen, you have less eggs that are released into the fallopian tube. Ovulation now becomes erratic. If there's no ovulation, progesterone is not produced. And if there is no balance, what happens when you enter into the perimenopausal phase? This is what's going to happen. The first sign of perimenopause is irregular menstrual cycles. Hindi hot flashes, hindi kakalumutin, hindi forgetfulness. This is the first sign of perimenopause. You have your menstrual flow that may become light or heavier or both. It could also be irregular heavy bleeding because of the changes now in the hormonal balance between your estrogen and your progesterone. In addition, when there is now a decline in your hormonal level, as you transition into menopause, 2/3 of all women are experiencing hot flashes. Okay, ladies, how many of you experience hot flashes? So not everybody. Okay, you're lucky if you haven't been experiencing it, but soon you will. Okay, what is a hot flash? Can you describe it?
Mainit, inaway ko na nga po yung ano.
I'm sorry?
Sorry. Share ko lang. Kasi I have this, matan ako na isang event. So, sa isang hotel siya, so expect mo, di ba, malamig. Tapos, hindi ko pa alam yung hot flashes before. Talaga pong inaway ko talaga yung manager. Not exactly inaway, tinanong ko talaga siya, bakit ang init-init sa hotel nyo? Bago-bago pa naman. Is it because madaming tao? Ang pala, sabi sa akin yung katabi ko, Mami, di ba menopause ka na? Oo. Hot flashes.
Okay, thank you for sharing. You can experience hot flash even if you're still menstruating, ladies. Okay? It is not only devoted to menopausal women. I want to make that clear. Okay? What is hot flash? It's a sudden wave of heat from the neck to the top of your head, associated with excessive sweating, reddening of the skin, and even rapid heart rate. It may last anywhere from 1 to 3 minutes, and it is followed by a sudden chill. Okay. Night sweats. Who experienced night sweats? Okay, night sweats are hot flashes at night and it interferes with your sleep. Okay? There is a myth. They say menopausal women are masusulit, irritable. But you know why? That's because of this. The decline in estrogen disturbs your sleep and it causes you anxiety. next day. It decreases your efficiency. And that's the reason why they say mga menopausal women masusuri. Okay? But it's actually the decline. It's because of the night sweats, the interference of the night sweats, of your sleep. How do you describe night sweats? You wake up in the middle of the night, drenched, basang-basa. Sometimes you have to change your towel, your pillowcase, your bed sheet. Kasi you're wet. Sometimes you're even thinking, umihi ba ako? Diba? Okay. Okay, so, as you move through that, remember the graphic presentation of those eggs. Now you have depleted functioning eggs, your ovulation stops, estrogen levels decline, menstruation stops, then here comes menopause. What is the average age of menopause? It's actually 50 years of age. But it can actually occur in mid-40s and mid-50s. Right? Hot flashes will tend to become worse in frequency and duration over the next 5 years. And 75% of all women will experience hot flashes even within the first year after your last menstrual period. Now, hot flashes and night sweats may be the menopause-related classic symptoms that incapacitate women physically. But they're also incapacitated emotionally and mentally. Why? Diba? Susie, you said sometimes you get confused. Direction na lang, you don't know anymore. They told you several times, oh, where am I supposed to go? Memory loss, sometimes you can't even remember, or you put your eyeglasses, or even your cell phone. This is really embarrassing. When I was at this point, I couldn't find my cell phone, only to find out it was inside the refrigerator. Difficulty in concentrating. But I hope you're not having difficulty concentrating and listening to me. Okay, what are the culprits? Menopause. Okay, this is crucial. Menopause, secondary to a loss or absence of your female hormones and the aging process. Right? Okay. Interestingly, in our brain, there are lots of sites in our brain that have high concentration of estrogen. Did you know that, Nadine? Okay. Estrogen has at least 50 actions in the brain, and most importantly, they have estrogen receptors, in the area called the hippocampus that is responsible for memory. Kaya paminsan, makakalimutin because of this. The lack of estrogen going through the hippocampal area. Sometimes, the lack of estrogen or absence also affects the decline in your serotonin. You know what the serotonin is? It boosts your moods. And therefore, when there's a decline, what happens? It resembles a roller coaster, right? Sometimes, ang saya-saya nyo. Tapos biglang iiyak na lang kayo. Isn't that right? Yes. And sometimes you tell yourself, am I bad? Should I see a psychiatrist? No, don't. It's just this. Okay? It's a roller coaster ride. And then even sometimes tasks where you are so efficient and organized, all of a sudden, everything is all in this array. Okay? So, that is because of your serotonin levels. Okay, this is interesting for the women who will complain of vulvovaginal issues. The amygdala in the brain is responsible for your psychological well-being and your sexuality. So when there is a deficiency in your estrogen receptors here, it will cause a loss of, results in the lost sense of well-being and low sexual drive. Sometimes you will even experience trembling. You mentioned that. Trembling, uneasiness, discomfort. Ito pa, this is so typical. Your patience is exhausted. You are temperamental. Hindi ka na you can't everything will snap at the click of a finger. And poor husbands, right? You just want to get that's my husband. Approve. Okay. Now, I want to set this on record. People think because they're menopausal, they're depressive. No. Menopause is not associated with depression. Okay? But it coincides with stressful events in our life. For example, children growing up, nagiging, what do you call this? Empty nesters. Elderly patients needing care. Parents, you take care of them now. And then even changing relationships. Husbands who retire, like my husband. Okay, he just retired. So I had to adjust. Okay, but that lead me to depression and midlife career change. Correct? Okay, so that is not menopause, okay? That is just part of the system or the event in your life. Okay, I want to point this out. When you see this, what does this remind you of? Letter V. V. Remember this. I did not show a picture of the vulva. Okay, late perimenopausal symptoms yan have profound effects on our vulvovaginal area. So, we have two V's. The vulva, the external genitalia, and the vagina. The vagina is not the vulva is not the vagina. So when you see this, nakabaliktad. This is actually, okay, your labial lips going downwards. Okay? Now, why do I have to bring this up? There are women who will not have hot flashes, who will not have night sweats, but the profound effects of late perimenopausal symptoms will hit them. And it will be what? Vaginal dryness, vaginal itchiness, vaginal discomfort, urinary problems, burning sensation. Ihi ka ng ihi, pero hindi mo maintindihan bakit. Nagpa-urinalysis ka na ng ilang beses, but there is no UTI. Okay? It is because of this. And the culprit is vaginal atrophy because the vagina dries and thins out. Because, remember, there are 3 factors that will keep and maintain your vaginal health. These are estrogen, lactobacilli, which is naturally occurring in your vagina, and an acidic pH. Okay, how does this happen? Your estrogen is not only responsible for your skin, your face, and other parts, even your hair. It is also responsible for your vaginal health. Those vaginal cells must also be lined with estrogen. And so when there is a decrease in the levels of estrogen in the vagina, it thins out. And when it thins out, the lactobacilli, which is present in your vagina, will also become deficient. And when this happens, your vaginal pH becomes less acidic, it becomes alkaline, then it starts itching, then it starts giving you all these other discharges. Okay, that in a nutshell. So the basic problem is the lack of estrogen. Okay. All right, this is very interesting. The vicious circle of vaginal dryness. It starts off with less vaginal lubrication. Di ba dry? You're wondering why. You look at your underwear, there's nothing there. And by the way, stop using panty liners, because panty liners will actually mask whatever problems you have there. So, if you have a decrease or less vaginal lubrication, and then it starts becoming more dry, and then because it's dry, how do you call that? Lumiliit yung opening, it becomes tight, and therefore when sexual intercourse comes into play, you have painful sex. Then you kick your husband away. Okay, now, take note. This is in the local setting, happening because you're having a decrease in your estrogen from the ovaries. It's in the local setting. But what happens? Because your estrogen receptors are also deficient in the brain, in the amygdala. So what happens? With continuous painful sex, you now have decreased libido, low sexual drive, and it will result in a declining sexual activity and the circle of vaginal dryness and unhappiness sets in. Okay? Okay, studies have shown that women who are sexually active during the climacterium phase, perimenopause, menopause, and postmenopause, have less symptoms and pain of vaginal dryness. Why? Because for every sexual activity, what happens? You actually improve the blood circulation in the vaginal canal. By doing so, it improves the vaginal cells to secrete moisture or wetness. And so, what happens? It's not going to be as painful as it being dry. So ladies, I'm sorry to say this, you have to have sex. Okay? More and more. Okay? Not less. Okay. I love you. Good. Okay. Now, for those who want to try and get this opportunity back to your lives, the only treatment there is estrogen cream. Okay, remember, what's the underlying factor? You have to think of the underlying cause. And that is because it is decreased because of the absence of your estrogen. So bigyan mo ng estrogen cream. Alright? Now, okay, here I actually will give you the spectrum. Early perimenopause, hot flashes, night sweats, anxiety, mood changes, memory loss, confidence loss, low sexual drive. Again, in my practice, not too many women will come to me with hot flashes and night sweats. More would come to me for this. Vaginal dryness, itching, painful sex, urinary problems, muscle aches and pains, thinning skin and hair, even in the perimenopausal phase. And for the postmenopausal, here you will see absence of menses for a long time. You may experience hypertension and then bone and heart problems. Okay, I talked about menopause. I hope I'm not boring you. Okay. Because we're still in menopause, ha? Okay. Tapos na tayo dun. Remember, it is the lack of hormones. Now, another factor comes in, and that is aging. Look at this screen. What is this showing you? That the aging process now sets in, regardless of time. There is no specific time. It is important to understand there are two important protein structures of the skin. The skin is the most affected, especially the face. Second will be the vulva. Okay. There are two protein factors that are important, and what are these? Collagen and elastin. Okay, look at this. Look at your collagen fiber. Look at your collagen fibers. They actually create a structural framework underneath your skin. So it actually is responsible to keep the firmness and the strength and the shape. Okay? Now, take note. Look at those balls. Those are actually the elastin fibers that are in between that structural framework that makes it pliable and resilient. Okay? So as you age, what happens? Your collagen and your elastin fibers become deficient. Okay, ladies, I want you to touch your skin now. Your cheeks. Pinch it. Okay, when you pinch, does it go back to its original face, shape? Galing nyo, siguro naglalagay kayo ng collagen at saka skin. Now, maybe it's time to look into the Pro-Age skin products. Okay, because that will improve your resilience. Okay, next. During the menopausal phase or postmenopausal,
The natural process now sets in. The skin becomes dry, flaky, wrinkly. Ladies, do me a favor tonight. Can you look at your face down under and see how wrinkled your vulvas are? Because that will tell you women go through a lot just to keep their face up externally, look good. But they're forgetting that their face down under is lagging behind. And that is because of your collagen and your elastin deficiency. Okay? Okay, everybody's asking about this. Fat distribution. Before menopause, where does the body fat get distributed? Hips, thighs, and here at the back. What happens naman during after pala menopause? Nasaan yung fat distribution? Yes, always. That's why it takes a long time to get rid of that, right? And what happens to our breasts? They sag, they flatten, and they lose their fullness. Okay? So, that is a reality. Okay. So, the falling levels of estrogen during menopause plus the aging process will lead to heart and bone problems. I'll briefly say that estrogen protects the heart. Okay, remember that. The postmenopausal heart disease will start with palpitation, shortness of breath, and may increase your blood cholesterol. Okay? Next, estrogen has a preserving role in the bone. What it does, it improves your calcium absorption, and therefore if there is a lack or low of estrogen levels, you start having bone loss and may lead to brittleness and porosity of your bones and may lead to osteoporosis. Okay? And remember, osteoporosis is the single most important health hazard in women post-menopause. Okay, this should be in your mindset. Okay? And so what do we do? What do we do, ladies? Okay, we need to be proactive. Okay, number one, it will vary from person to person. You need to understand the science behind the journey. Did you understand the science behind this now? No one is spared. You need to take tab of all the signs and symptoms that you are experiencing and will evolve through the years. Find a doctor. It is important to see your doctor who will give you an overall status of your health. Someone who can walk with you in this journey. Someone who probably has gone through it or going through it. Someone who can empathize not only with your experiences, but will examine you. Okay, there's a difference. Who will examine you and fact it. Alright? Someone that you can talk to, you can cry to. Just yesterday, I had 2 or 3 patients crying to me because of the difficulty that they're experiencing. It's fine. Okay, so find the right doctor. There is no one drug fits all. There's no specific treatment. It has to be individualized. It has to be customized. What is important that the right treatment is exactly what will address your current situation. Okay? Next, health tips. Create a positive life change. You cannot keep saying, it's too late, it's too late. Nothing is too late to make yourselves happy. The key is happiness. It is important to change your life's attitude, make better relationships and friendships. What you need to do is to join organizations, community, social responsibility agencies, and important to create a wide range of people, younger and older than you. Younger because they can stimulates the mental alertness, and older than you. I like to have people who are older than me because it makes me hopefully less fearful of what lies ahead of me. Okay? And what else? Laugh, talk about it, live about it, and remain active. I'm not telling you should go jumping and do those other sports, strenuous activities. No, just walking with your husband, walking with your dog. Okay? Yes, right? That's all you need to do. Do you know that there's a study now that associates walking, exercise, 3-4 times a week, 30 minutes a day, it is now connected to longevity. Alright? Next. Is it doom or gloom? What do you think? My advice is for the young ones, 40s or 50s, to start planning for your 60. Now that you're 40, 50. Taking steps to improve your health and your financials is the best step, earliest step, to prepare yourself to enjoy and relax over the years that is 60 years and above and beyond. Look at this slide. I'm almost done. What can you say about this slide?
All smiles. All smiles.
They're all laughing. Life will offer us so much richness every day. We just need to look beyond the growing years and growing number in years. Okay? And remember, I like to end my talk always with this. AGE. Remember, age is only a number. A means acceptance. We all need to accept we will all go through menopause. Huwag na natin i-deny. Nandiyan na yan eh. Okay? We all have to go through that. Okay? We will all pass through that, but in different ways and in different degrees. Next, letting go is freedom. What does that mean? To me, GO means 60. I like to say that 60 is the new 40. Alright? Because when you let go, you have me time. Me time is self-love, self-care, positive vibes to renew, to restore, and to rejuvenate your spirit. And next, experience. There is no substitute, okay, to the number of years behind us, alright, that will tell us what's going on. Because we have become older and wiser, because experience never grows old. The knowledge and the lessons that we learn through these experiences will actually power us to steer us towards this journey we call menopause. And last but not the least, however young we feel, I feel young, but I'm 66. Aging is inevitable. There's no ignoring the facts. My body has been here for 66 years. Age is only a number. And like any home body, there's an upkeep and maintenance to make sure that the quality of the body and home is there. So my suggestion, it's time for you to look into your bodies, listen, meditate, be mindful of the things that's happening to you. We will all go through menopause. How you want to live it is your choice. But it is important that you embrace your age gladly and make sure and allow these experiences to empower you through this journey called menopause. Thank you.